Welcome back to WKYT. Joining us now, Dr. Yaz Daaboul, here to share vital insights on heart health, especially for Kentuckians.
Dr. Daaboul, thank you so much for being here with us today.
Destiny, Victor, thank you so much for having me.
Heart health is so important and so many people struggle with it. What are some of the things that Kentuckians can do to take care of their hearts?
Yeah, thank you. I mean, that's a great question. You know what we do know nationwide in the United States, every 42 seconds, somebody dies of a heart attack. And this number has been, unfortunately, very consistent, since the 80s and the 90s. And back in the 80s, the most common cause of death in the United States was heart disease. You know what it is in 2025?
Still heart disease. Yeah.
So unfortunately, despite a huge amount of work that we've done over the past, multiple decades, heart disease is still the #1 cause of death nationwide. And unfortunately, Kentucky is in terms of performance with the state and mortality from heart disease, we are still seeing the highest rates of death. And this, practically speaks to the cardiovascular risk that exists in the state. So there's a lot of room to modify risk and to improve people's quality of life, quantity of life, by addressing some of these cardiovascular risks. So Kentucky, we should really be addressing some of these biggest risks in the state of Kentucky, and I think we have a lot of room to make the most amount of improvements here.
What are some of the steps whenever you have a patient who come in who may be at risk for certain things? What are some of the steps you tell them to take?
Yeah, there are the traditional risk factors that we know about, which include weight status. We want them to always maintain a certain weight level that is not exposing them to an excessive amount of risk. Also things like blood pressure, so hypertension is a cardiovascular risk, hyperlipidemia, diabetes, smoking. So these are all the traditional risk factors that if we address those, we have a big substantial opportunity to modify risk. Unfortunately, there are some non-modifiable things like genetics.
Yeah.
So this is where we cannot modify that, but at least we can detect things early. So the other things that we always address with patients is early recognition, early identification of disease. Follow up with your doctors regularly so you can screen for things before they become a problem. And this is how we can prevent disease before it actually becomes a disease.
How can we improve heart health on a day-to-day basis?
That is an excellent question. On a day-to-day basis, it's all about the small habits. So you're going to read a lot on social media everywhere. You take, vitamin whatever or supplement whatever, and then, your heart is doing substantially better. Unfortunately, a lot of these have no foundation or, basis. So, these are the heart hacks that really don't work because they've never been proven. The real heart hack, the health hack is basically, the small steps that you do or the small lifestyle habits that you take to make your life better, including making sure you're maintaining a certain calorie, number per day, so you're not gaining too much weight or, losing too much weight. Going to the gym if that's something accessible to you, or even doing daily walks. It doesn't always have to be expensive. And heart health, really starts in the kitchen. It doesn't even have to be at the doctor's clinic. Having a healthy diet is really what heart health is all about.
I've heard before, you can't out-exercise a bad diet.
No.
So it
correct.
seems like we'll just kind of build that base there. All right, if people want more information, I guess, should they reach out to you, just talk to their doctor? Best steps for
Yeah,
that?
reach out to your local doctor, whoever's available to you, your primary care doctor. Obviously, if you ever need a cardiologist, there's cardiologists hopefully everywhere, so we're always accessible. And but definitely reach out to your local provider, because I think this is the first step to maintaining a good heart health.
Thank you. Thank you so much for being here with us today.
Thank you so much for having me.